Well, apparently there's a big problem with racist patients running amok in hospitals. You'll want to pay attention to this, folks. This is a new policy in the UK, just came out. UK has decided not to provide health care to patients who use offensive or racist language in their, I guess, communications with the staff. I'm talking about this because the thing that came to mind immediately when I read this was the soup Nazi from Seinfeld. Remember the soup Nazi from Seinfeld? He'd be behind the counter, he'd be dishing out the soup, and somebody would do something inadvertent to offend the soup Nazi, and the soup Nazi would pull the soup back and say, "No soup for you. No health care for you." Offensive, racist people. I don't know what the difference, honestly. Well, of course I do. I mean, look, racism is based on intent, right? It's completely subjective. It's how you mean what you say. It's not necessarily how the person who is listening to what you say interprets it. That is a completely subjective experience. And for these hospitals to be literally not providing health care to patients who may say something that is taken as an offense by one of the workers there seems to me a little crazy, like we're reaching the pinnacle of political correctness and we're heading over the cliff. So for those of you who are awake and paying attention to all different kinds of crazy government intrusion, this is something that you'll certainly want to pay attention to. This is Carl Brizzi. You're listening to Carl Brizzi Live. I try to talk about these things with a measure of objectivity, and I can disagree. I can disagree with you without being disagreeable. However, in this case, I'm not sure how objective I'm going to be, because I'm one of those people that has very definite biases. I have preferences. I like a certain kind of food, a certain kind of steak. I like it prepared a certain way. I like the my wife or the girls that I've dated. I like them to have a certain look, a certain quality, a certain affect, maybe even a sense of humor. They're good to talk to. They're nice to look at. These are certain things that are subjective to me. These are biases. These are preferences. So if you're a patient and you're in a hospital and you want a doctor, let's say you want an Asian female doctor who went to a certain university because you think that doctor may be a better doctor for you, why can't you have that preference? People do it with lawyers. People pick their plumbers. People pick the people who cut their grass and put shingles on the roof, but you can't pick your healthcare provider in the UK without risk of getting your health benefits cut off. And that's a problem. We're going down the road of, precogs in Minority Report, where people are, trying to figure out what you meant by what you said before you said it. All the isms, Rob, the sexism and the racism and the primitivism. You know what primitivism is?
I know what Carlism is.
What's Carlism?
We're enjoying it right now.
All right. Well, here's the other super offensive thing, if I can just use this word, about how this hospital is rolling out this. They're rolling it out with a sports analogy, okay? This is how crazy this is. They launched the red card to racism. Like, what is that, soccer, where they have the red cards? The red card to racism campaign to prevent all the staff from discrimination. Now, let me ask a question to those of you who are smarter than me, Rob. How in the world can somebody discriminate against a healthcare worker? You're a patient. You're lying in a bed. You're sick, right? Now, if you believe in the whole hierarchy of power, the person who is treating you is the person with the power. How can you discriminate against somebody who has all the power? Simply by saying, well, I guess you just can't speak, because anytime you speak in any sort of meaningful way, you risk being offensive, right? I'm not saying that every time you open up your mouth, you are offensive. But anytime you say something meaningful, if it's completely subjective to the person that you're talking to, then you risk offending. Am I right? I think I'm right. So the hospital says, following a national trend, staff have reported that incidents of racism on wards have increased over the past year. So the hospital will be enforcing, and I love this term, zero tolerance policy against abusive and offensive behavior. This means that any patient abusing staff will be challenged and warned, leading to a sports-style disciplinary yellow card. Come on! This isn't even funny. A yellow card and then final red card in which treatment would be withdrawn as soon as safe or after the patient has deceased. I've just made that last part up.
So question, Carl. If you didn't like your doctor because he or she sucks,
right,
and let's say they were a different color than you, the doctor could claim it's just because of their race?
Yeah. What if the doctor had a really thick accent and you didn't understand what the hell he was saying or what she was saying? And you're like, look, I have a very serious heart condition and I don't understand what you're saying. You sound like you're speaking with marbles in your mouth and I don't get it. Is there a translator available? No. Then can I have a different doctor, please? I mean, I'm making a joke here, but you can see where that would very easily could be the case, especially with older people, you know, grandparents and people who fought in World War II and some of the wars. They might have some post-traumatic stress if they're lying in a hospital bed and all they see are, you know, Asian faces around them or you know, German face. I mean, I don't know. People are all different. We live in a multicultural, diverse society, and so people have all kinds of thoughts, and they may be unreasonable thoughts according to you and I, but they're still their thoughts. And well, at least up until recently, people got to express those thoughts, even if they offended some. I mean, that's the whole point of the First Amendment. We would need the First Amendment if everyone went around trying not to offend everyone else. Here's Andrea Young, the chief executive from that hospital. Now, check this out. We have staff from many different backgrounds from all over the world, and we pride ourselves on our commitment to equality, which is a fundamental value of the hospital. What in the heck does equality have to do with providing health care to somebody who's sick? I don't get it. I mean, anytime you hear equality used in that context, everyone's antenna should just go up because it doesn't make any sense. This is what they're saying. This is their own words. Now listen. We're sending a strong signal that any racism or discrimination is completely unacceptable. Any. We want staff to challenge and report it. And we want everyone, and here's my deep Orwellian voice, to know that it will have consequences, Jason. Consequences? Like what kind of consequences? Like flatline consequences, brother. Because you're deplorable, and the world is already overpopulated and would be better off if you were just dead. The abusive policy behavior covers anyone with mental capacity, meaning if you're high or whatever and you're saying stupid things, that's one thing. But if you're lucid and you use racist or sexist language like, hey, honey, bring me my bedpan, something like that, that'd probably be yellow card worthy. Call a foul on that. Here's one: excessive noise. Now, how is noise racist? How is noise sexist? How is noise abusive? Noise is noise. It's like a gun. It's just a thing. A gun isn't racist. A gun isn't sexist. It's a gun. Here's another one: threatening and offensive language. Bring me my morphine now, damn it. I'm in a lot of pain. Red card. You're out of here. Red card. Here's one: malicious allegations. I love this one. Hey, yeah, last night the orderly snuck in and removed my dressing gown, and I think I may have been assaulted. Red card. Racist. This policy will be reported on the patient's charts and will follow them forever. So this is the most insidious thing about it. It's like, not only can this hospital deny you treatment, kick you out, But then it's in that mysterious chart, where everything gets written down. This is why when I talk to my doctors, I say, you put that pen away. That doesn't need to go in there. Put my height, my weight, blood pressure. But when I tell you the thoughts that I have of dressing up in fancy evening wear, the third Thursday of every month. Just kidding. We're going to have posters and videos and photos around the hospital to inform the staff that they're protected by the policy and encourage them to speak up. See something, say something, Rob. Speak up if they witness or experience an incident of racism or discrimination. And again, I don't know how a patient could discriminate against a hospital employee. I've been thinking about this for 2 days, and I don't know how it works. I don't know how that would work. So somebody, after you listen to this, explain it to me. The hospital will also be calling for its staff to join Black, Asian, and minority ethnic network to champion the approach and to provide support to any affected staff. Doesn't this seem like ass backwards? Like they are so worried about providing a comfy, safe space for all these triggered healthcare workers. I mean, look at this. To provide support to any affected staff. It's truly bizarre. Don't dare to offend is basically what they're saying. And when you say to someone, don't dare to offend, what you're essentially telling them to do is to self-censor. And self-censorship, we've talked about it before, is the most insidious kind of censorship because you're doing it to yourself because you're afraid of what the consequences will be of articulating a thought that somebody might take offense to, which again, I go back to, if you're going to say anything meaningful at all, like I'm trying to say right now, I risk offending someone. And that risk goes up exponentially as it does with the number of people who are listening to what I'm saying, right? So if I have 100 people listening to this, the risk is a lot greater of offending one of the 100 than if I'm just having a conversation one-on-one with people. So if people are actually listening to what you say, the risk of you offending goes up quite a bit. And I'm not saying that you have to be offensive every time you say something meaningful. I'm just saying that the risk is there. I mean, who gets to decide what's offensive? This is what's crazy about what's going on. What is offensive? What is racist? Who gets to decide? The hearer gets to decide? Well, you're just putting, you're just hammering down the First Amendment into basically meaning nothing. If my speech is going to be regulated by the subjective feelings of the hearer. But I guess that's the situation that we're in. My mom was had cancer, was in the hospital for a long time. She was in hospice for a while. She was a Brooklyn, Italian, highly energetic. She still had a very, aggressive Brooklyn accent and a very, aggressive demeanor. And she hated Barack Obama so much. And, she was kind of in and out. And, definitely if there was a policy like this in some of the places where she stayed, I guarantee you somebody would weaponize that term racism, to get the upper hand because, she was probably a lot to deal with. At one point I had a cardboard cutout of Obama that a friend had at her 50th birthday party. And I was going to sneak it into her room while she was sleeping. And she'd wake up and she'd see 6'2" Obama cardboard cutout, but she did not like Barack Obama, and it wasn't because he was black. She thought he was a crappy president. That was her deal. But I could easily see, some triggered healthcare worker being like, "That woman is a racist. Yellow card her, red card her, get her out of here." And that healthcare worker, apparently one healthcare worker, gets to decide whether some patient is racist or not based upon that healthcare worker's interpretation of what that patient says, or not even really what that patient says, what the healthcare worker says the patient said, right? Because that's normally how it happens. Nobody is really witnessing all of this or recording it. It's all based on observation and recollection and how it affected me. Please stop being so emotional, people. It's so annoying. Grow up. If you know what, if you disagree with President Obama, you're not a racist. If you voted for Trump, you're not a racist, right? Those are your preferences. Now, you may be a racist if you didn't vote for Obama. You may be a racist if you voted for Trump. But stop throwing those things around as if they're fait accompli, because they're not. And it just makes middle-of-the-road people angry at those kinds of accusations. You know, if you lock your doors at night and you believe in securing the country's border, you're not a racist. That's a legit concern. If I'm eating a burrito at Taco Bell, I'm not a reverse racist. I'm not trying to misappropriate the Mexican culture or the Hispanic culture by doing that. Maybe I just like burritos. Look, we all have our preferences. We all have our biases. And you're allowed to like what you like. You're just allowed to like what you like. And racism, I said this before, it's about intent. And look, you don't have to get hit by a 400-pound lineman to know when somebody is really trying to be offensive, right? We all, it's like obscenity, right? The definition of obscenity. You know it when you see it. When somebody is really being an ass, everyone around them knows that they're being an ass. And it's way less subjective. But judging someone's intent sets us on a very slippery slope because it's a subjective test. And subjective tests are tricky, as we all know. You know, I don't know why this is the first thing that we do. I mean, it would seem to me it would make sense if you're concerned about healthcare and healthcare costs. You know, there are other limiting options other than race. Unless you're just trying to make a political statement, like, do you smoke? Yeah, that's going to be a problem for treatment. Do you drink too much? That may be a problem. You have a problem with sugar? You need to cut down on the sugar before we spend these resources on you. You know, are you obese? Are you not obese? These are objective things that we don't seem to focus on. I'm not saying that we should focus on them because I don't think that those ought to be factors when you're evaluating somebody's medical treatment. There are ethics involved, and patients have rights within the healthcare system, and those rights ought to be observed. You know, regardless, everybody has bad habits. So if we're going to go down the road of you know, censoring speech and limiting access to healthcare based on bad habits, that's going to be a real problem. I just had a thought. What if access to healthcare is restricted based upon dangerous political views? That'll be my next podcast. Thanks for listening to Carl Brizzi Live. Carl at carlbrizzi.com. You can catch us.